Good afternoon. I'm Terry Scoggin, CEO of Titus Regional Medical Center in Mount Pleasant, Texas. Today's Friday, October 1st. It's another month. Here we go. So October 1st, 2021, we're excited. Thank you for joining us today for our COVID update. I want to say thank you to last night to Dr. Steve Siegel with Titus Regional Medical Center and the Heart and Vascular Center Institute and the Cath Lab for inviting us last night to join him and the American Heart Association for a presentation he did down south of us, south of Gilmer, at the home of a couple down there, the Crumbs. Very nice couple. We got to meet a fellow peer of his from the Tyler area and talk to the American Heart Association of what they've done, not only in just across the United States and some of the things they're doing, but especially in Northeast Texas. So it was very exciting. It's always exciting to tag along with Dr. Siegel and hear the things that's going on here in Titus County and in Northeast Texas and some of the advancements. And we'll be sharing some of those over the next few weeks and months. But some great things going in our cardiovascular program here at Titus, and just want to thank him for the opportunity last night just to see lives that he's changed and this community's changed. So it was exciting. So thank you, Doc. As far as the numbers go and the fourth surge, last week's been really nice. It's been a nice decrease for the first time since late July. That we've seen. So you're going almost 2 months now of increase after increase after increase in capacity. We finally, over the last week, saw a week-over-week decline. And today we're sitting with 7 hospitalized patients, only 1 in the ICU. So from COVID. So 7 hospitalized patients and 1 with COVID. So it's the first time we've seen that decrease. And the decrease is not only at Titus Regional, but we've seen it across East Texas. And I just got off the phone with the Texas Hospital Association and listening just to the updates from other CEOs across the state of Texas for their regions. And most everybody's seeing these same results. The hospitalized patients continue to decrease. ICU patients not falling off as quickly as hospitalized patients, but if you think about with Delta variant, it's really hit some patients hard in the ICU. So the length of stay has increased 4, 5, 6 days easily for many of the patients. So the fact that your ICU is a lagging indicator probably won't see that decrease dramatically for another 5 to 6 days or maybe even 2 weeks as we'll see that go down. But a little bit down yesterday. The Tyler region, you can see their numbers, hospitalized patients consistently go down. And then from an ICU patients, a little more decrease than what we saw in our area. So we're glad to see it. Both Tyler and the Dallas area are precursors to what we normally see in East Texas. You can see the Dallas numbers here from 3,200 to 2,500. So significant increase in hospitalized patients. So we're glad to see it. We're excited as we start to see more flu in the area. We're glad to see this decrease so we can focus on flu shots and we can continued focus on vaccinations in this area. But just wanted to share this news. Boosters has been a big discussion, and it will be a discussion for the next few weeks. Pfizer did come out with the CDC recommending a Pfizer booster for several different areas. You'll see in there a lot of mays and should. You should or you may. And those are the things. We are offering the booster for Pfizer. It is not recommended that you mix Pfizer and Moderna. The majority of the people in Northeast Texas that we worked with received the Moderna vaccine, and that has not been discussed for a booster as of yet. So again, my recommendation is talk to your primary care physician, talk to your doctor. It just really depends on your situation and your underlying medical conditions. And we encourage you just to talk to your physician if this booster is appropriate for you or not. From a vaccine perspective, continue to see increase in Northeast Texas. Not at the rate we'd love to see, but at 0.515, we continue to increase. We are at 0.409 for fully vaccinated. This is the first time we've increased over the region's average, which is a big win. That region is all of Northeast Texas. So we're continuing to push vaccine. We're continuing to offer the vaccine. That's where our focus is going to remain, first dose. Even if you've had COVID and you've passed your 90 days, if you've had Regeneron or anything like that, we still encourage you to get your vaccine, especially if you have comorbidities. It mitigates that risk of something happening in a severe way, being hospitalized or ICU. from a Titus perspective, just the last thing, September was tough. We saw more deaths in our hospital in the history of the 70 years that we've been a hospital in 1 month. From a COVID perspective, we saw more deaths this month than we've ever seen in this hospital. It was hard on our team, and I would continue to encourage you, even though we've seen the gap for the first time and the surge decline, please pray for our doctors, pray for our nurses, pray for our clinical team members, as they deal with this grief. And for there's many of our community members, as we fight this disease, many of our community members lost a friend, lost a loved one, or lost someone special to COVID, especially over this last month. It hit this community really hard, and all of Northeast Texas, just not Titus County. So please remember these people in your prayers and their families in your prayers as we continue to fight this disease. From a vaccination standpoint, Titus Regional Medical Center continues to keep our clinic open, and we will. It's on the first floor of the Medical Plaza, Monday, Wednesdays, and Thursdays, 7:30 to 1:30, and then extended hours on Tuesdays. But I encourage you, if you've not had your dose, your first vaccine or your second vaccine, please go get your shot. It's one way to mitigate the spread and reduce the risk for you. We're excited this week with the Titus County Fair. My clicker stopped working, but the Titus County Fair is this week, and we're excited about that. We are having a vaccine clinic at the Titus County Fair, and I have a picture there, but we'll go from there from that one. Would also like just to encourage you over the next few weeks. We have a few things coming from things that we're doing here at from a Titus Regional Medical Center. We do have next week our Tennyson Health Fair, not this Saturday, but next Saturday. I believe that's going to be October 9th. But we do our fair, that Tennyson Fair that morning. It's a great opportunity to come out. We'll have flu vaccine there. We'll have many different people with different resources and health resources for the Northeast Texas and Titus County and TRMC at that event. We will do a lot of it outside that day because we're still trying to minimize the number of people inside, so we're excited about that. Also next week, I know we have our bingo for bags, and there's our fair coming up. So we got our pictures of our fair, and Michelle Shoemate and the team are doing a great job. So get your corn dogs, get your funnel cake, and go join Michelle and get your vaccine from there. Want to show you something special. I'm glad Bobby D was able to get our technical difficulties because this was something special that happened yesterday or Wednesday. We had a friend of many of us in Titus County who's been in this hospital over 55 days fighting COVID and has fought all different realms. And earlier this week on Wednesday, had the opportunity for us to celebrate almost hitting 60 days here in the hospital of him going home. I just want to share this moment with you and let it share and you see it. Hit play. We wanted to share that with you. It was emotional, and we had the opportunity just to celebrate, play a little music, and throw a little confetti. And it was a long, hard-fought battle, and still fighting it and still rehabbing. But we were glad to celebrate his leaving the hospital and going home. And he was overwhelmed. It was exciting for a lot of our team members. It was emotional for our team members as well. Bingo for bags next week. Please don't forget. It'll go online, so watch Facebook and those things. It is going to be a smaller venue this year. It's going to be a smaller event this year at the same venue just because of COVID and our protocols. Again, we're wanting to move on. Just like the rest of the community, we'll start doing these things. We'll have to restrict attendance just because of the number of people that we can safely spread apart with masks and everything. I did see a question about can eligible people get the Pfizer booster. At Titus Regional Medical Plaza, yes, we are giving the booster now. If you meet those criteria, there's an attestation form you'll fill out that says you meet those criteria. So we are starting to offer it next week, so we should be good to go. Also, there is the health fair on Saturday, October 9th from 8 to 11, so we're excited about that. Just want to continue to thank you. Sorry about the blurb and had to go from memory on some of the pictures, but truly appreciate you joining us today. With the decrease, we're probably going to take next week off, and that's a good thing. You probably don't want to see me for a week if we can do some things that not have to hear about COVID. And I'm hoping we'll continue to see that decline. We'll continue to put information out on Facebook. We'll continue to work on our vaccination rate and work towards that. So, again, on behalf of everybody at Titus, just want to say thank you for your support. God bless.